Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be doing another slideshow presentation and talking about information regarding Quetiapine. Its brand name is Seroquel. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So first off, let's briefly talk about what we're going to cover in this presentation. So we're going to talk about how quetiapine works as a medication. We're going to talk about indications for when it's prescribed or reasons that it's prescribed. We're going to talk about some contraindications or reasons that a patient would not be able to use this medication. We're going to talk about some examples of dosing and then finish it off with side effects, including percentages. So how does quetiapine or Seroquel work? Well, it's a mood stabilizer due to combined antagonism of dopamine D2 receptors as well as serotonin 5-HT2 receptors. And it has efficacy in major depressive disorder, partially explained by its norepinephrine antagonism. So now indications. When would this medication be used? We would see this medication prescribed to treat the depressed phase of bipolar disorder. We would also see it used in management of bipolar disorder paired up with lithium or divalproex. We see it as an adjunct therapy or an add-on therapy in major depressive disorder, and we also see it used to treat schizophrenia. So now some contraindications or reasons that the medication would not be able to be prescribed. The first off would be an obvious one if a patient had a hypersensitivity or allergy to quetiapine or any other component of the product. It's important to note here that elderly patients with dementia-related psychosis should not be given quetiapine. This one here I have an asterisk by because it's not clearly a contraindication, but it is noted that the medication should be avoided in elderly patients with dementia or delirium due to an increased risk of cerebrovascular accidents as well as mortality. Now for some examples of dosing. So in bipolar disorder, if a patient was receiving the immediate release tablets, they may use 50 milligrams once daily on day 1, followed by 100 milligrams once daily on day 2, then 200 milligrams once daily on day 3, then 300 milligrams once daily on day 4. And all of these doses would typically be given at bedtime. In major depressive disorder, as an example, if somebody was using the extended release tablets, they would typically use 50 milligrams once daily in the evening and then increase this dose to 150 milligrams in the evening on day 3. The usual dose range would be between 150 and 300 milligrams per day. And finally here, we'll talk about some side effects associated with quetiapine or Seroquel. This medication may cause an increased diastolic arterial pressure 40% of the time. Up to 7% of patients may experience orthostatic hypotension, which would be a sudden drop in blood pressure when going from a seated to a standing position. Tachycardia or a rapid heart rate may happen up to 6% of the time, and 7 to 18% of patients may experience raised serum cholesterol. Raised serum triglycerides may occur 8 to 28% of the time, and 3 to 28% of patients may experience weight gain. 3 to 7% may experience abdominal pain, and constipation may happen 2 to 11% of the time. Increased appetite may happen 2 to 12% of the time, and indigestion may happen 2 to 7% of the time. Nausea and vomiting are possibilities, and xerostomia or dry mouth may happen 9 to 44% of the time. A backache may happen 3 to 5% of the time, and asthenia or abnormal weakness may happen up to 10% of the time. 8 to 19% may experience dizziness. 17 to 21% may experience a headache. 8 to 12% may experience insomnia. And somnolence may happen at a rate between 18 and 57%. A tremor may occur in 2 to 8% of patients, and agitation can happen up to 10% of the time. And finally, some patients may experience pain. This comes in at 7%. That's all I have to talk about today with quetiapine or Seroquel. As always, I'm very thankful you took the time to go by and watch one of my episodes. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.